Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it most often appear as a single stripe of blisters that wraps around either the left or the right of your torso. Shingles are caused by a virus called Varicella Zoster, the same virus that causes chickenpox. After you have had chickenpox and the virus lies inactive in your nerve tissue in your body for a long time, in your spinal cord and your brain, if it's being activated many years later, it's gonna come back as a shingle. You get it right? Okay. Shingles can be very painful, but yet it's not a life-threatening condition. And there are a lot of vaccines that have helped reduce the risk of shingles, while early treatment can help shorten a shingles infection and lessen the chances of complication. Alright guys, we're going to be looking into the symptoms of shingles. Now, the signs and the symptoms of shingles, they're usually affected only on a small section of the side of your body, and these signs is what you usually see when you have a shingle in your body. You're gonna feel a sharp pain, a burning, a numbness, a tingling sensation, and kind of like a touch. Someone try to touch your body and you feel a sharp pain. And for most people, you see a red rash that begins a few days after the pain, and all of a sudden the fluid-filled blisters will break open and cross over, and in most cases it will start itching and continually. Sometimes people, some people experience fever, headache, sensitivity to light, fatigue, and lots more. So, the key ingredient about shingle is the pain. Pain is usually the first symptoms of shingles. For some, it can be very, very intense. Depending on the location of the pain, it can be sometimes be mistaken to be symptoms of a problem affecting the heart, the lungs, or the kidneys. Some people experience a single pain without ever developing the rashes. Do you understand? So you can get to the point where the shingles in your body is trying to manifest, is trying to be activated, and you already start feeling the pains even without the rashes. So these rashes are rashes, don't easily come over because it's depending on your gene and the way it's actually producing in your body, it will not turn up as fast as possible. There are sometimes you realize that little kids are having rashes on their neck and their back, and that is obviously a heat rash because it's going to go away when you apply some kind of dusting powder on it. But shingles is way different from all this kind of stuff, because shingles kind of like get a boil, a water inside, kind of like a toxic substance inside it, and when it starts coming out in the part of your body, it comes with high fever and pain all along with it, and it gets to a certain stage when you bust it, the water in the shingles spill all over your body and it becomes itchy and the pains increases. So the pain in the rash occurs near an eye. If left untreated, the infection can lead to permanent eye damage. And if you are anywhere above 70 and older, because of the age issues, or because somebody in the family that is having a weakened immune system, or you got somebody who's going through chemotherapy because of cancer and chronic diseases, or rash, widespread and painful, you need to be very careful right there. Basically, shingles is caused by a very deadly virus. A deadly virus called Varicella Zoster. Varicella Zoster virus. Very wicked virus. You know, why do I call it a wicked virus? Because the same virus causes chicken pox. Can you believe that? Anyone who's had chicken pox in the past have likely percentage of developing into shingles in the future. After you recover from your chicken pox, the virus can enter your nervous system and lay dormant for years. Eventually, it may reactivate and travel along the nerve pathway to your skin, producing the shingles. So, the reason for the encore isn't clear, but it may be due to the lowered immunity to infections as you grow older. The shingles is more common in older adults, in people who have weak immunity and weak immunity system. So when you look at Varicella Zoster as being a part of the group of the viruses causing the herpes virus, which includes the virus that is causing the cold sores and genital herpes. Because of this, shingles is also known as the herpes zoster. But the virus that causes the chicken pox and the shingles is not the same virus responsible for the cold sores or genital herpes or sexually transmitted infection. So, how are you going to know if you are contagious? How are you going to know if you are not ready, to associate with people in your locality, in your present community? How are you going to know that you are contagious or you are not contagious? How are you going to know that? So, anyone who has a weak immunity or has a weak immune system, for instance, a newborn baby, a pregnant woman, they are at a very high risk of being infected with shingles. So you need to be very careful when you are labeled infected. If you are a family member and for some reason you got shingles, maybe outside in your work area or in your school area, and you come back home, you need to be treated first before you can get back home and start living with your family members. Alright? We're going to be looking at the risk factors of shingles and all the BS that comes with it. So the risk factors here are anyone who has ever had chicken pox is likely to develop in the shingles. Did you get that? So if you have any history of chicken pox in the past, you have likelihood almost 90% that you can develop in the shingles. You get it? So there are some factors that increases the risk of you having shingles. It's usually your old age. If you're being older than 50, shingles is most commonly in the people older than 50. The risk increases with your age. If you're suffering from some kind of disease that weakens your immunity, like HIV and AIDS and cancer, you have a very high risk of contracting shingles. Or if you are undergoing cancer treatment, radiation or chemotherapy, it can as well lower your resistance to the diseases and may equally trigger the shingles. So be very concerned about the stuff that you're taking, the drugs and the designated injections that you go in transplanting organs that is increasing your high risk of shingles and can prolong use of steroids such as prednisolone. Did you get it? Now, there's some kind of question that people ask about complications. We just come over and they want to know what are the complications of shingles. If you have any sort of complication, what's it going to be when you're thinking about complications in shingles? For some people, shingles pain continues longer after the blisters have cleared. This condition is known as prosthopedic neuralgia, and it occurs when damaged nerve fibers send confused, exaggerated message of pain from your skin to your brain. Now, another problem that you're likely to face is vision loss. Shingles in or around just the eye area can cause a painful eye infections that may result in vision loss. So neurological problems is also one of the problems you can face when you're going through shingle contaminations, because depending on the shingles and on which nerves are affected, shingles can cause inflammations of the brain, encephalitis, facial paralysis, or hearing or balance problem, skin infections. If shingles blisters are properly treated, bacterial skin infection may develop to preparing you for some sort of problems. Now, these are the things you need to consider, especially when you're going over to meet your doctor, your family doctor. So you should go ahead and write a list. So when you're preparing for appointment, go ahead and write a list. Write a detailed descriptions of your symptoms and give our information about your medical problems, your medical problems in the past and the present. Give information about your medical problems of your parents or your siblings, because sometimes it might be something that's running in the family, so you're gonna need to update your family doctor so they know how to tackle the problem. Now, you're gonna need to write all the medications, the vitamins, the dietary supplements you're taking. You're gonna need to make a list of the questions ahead of time that you're gonna need to ask, and get prepared. Make a list of questions for more important things in case you run out of time. And you might want to go with somebody in case it's something that requires an emergency and you are required to be hospitalized. So it's part of the drill, especially when you're going over to meet a doctor. So, and another thing is, in addition to the questions that you've prepared to ask your doctor, do not hesitate to ask any additional questions that occur to you during the appointment. These are the common questions you might see or you might hear from your doctor. You're going to see some kind of question like, when did your symptoms begin? Does anything make them better or worse? You might hear something like, do you know if you have ever had chickenpox? Do you understand? So this kind of likely question you might see, especially when you're going over to meet a doctor. Now we're going to look at the text and the diagnostics that you take, especially when you're going over to meet a doctor to counsel you about your shingle. So when you're going over to meet a doctor, this text comes up. Shingles are usually diagnosed based on a history of pain on one side of your body, along with the telltale rash and blisters. Your doctor may also take a tissue scraping or a culture of the blisters for examination in a laboratory. These are the treatments and the drugs that you need to manage the problem. Unfortunately, there is no cure for shingles, but prompt treatment with a prescription antiviral drugs can speed healing and reduce your risk of complications. Now, these drugs include acyclovir. The trade name is Zovirax, and the generic name is acyclovir. Another one is valacyclovir, trade name Valtrex. Another one is famciclovir, trade name Famvir. Shingles can cause severe pain, so your doctor also may prescribe capsaicin cream. You might want to take some capsaicin cream, anticonvulsant such as gabapentin, Neurontin, tricyclic antidepressant such as amitriptyline, tricyclic antidepressants such as amitriptyline, numbing agents such as lidocaine, delivatvir cream, gel, spray, or skin patch. You're gonna need stuff like medications that contain narcotics, such as codeine, an injection including corticosteroids, and local anesthetics. Shingles generally last between 2 to 6 months. And most people get shingles only once, but it's possible to get it 2 or more times. These are the lifestyles and the remedies you might see at home, especially when you're going through a shingles infection. Now, these 2 vaccines may help prevent you from getting shingles or the chickenpox. Varicella is a very powerful vaccine, and shingle can be treated with Varicella Zoster vaccine. But when you look at a chickenpox vaccine, you can take Varicella vaccine, Varivax. Like chickenpox vaccine, the Shingles vaccine doesn't guarantee you won't get shingles. But these vaccines will likely reduce the course and severity of the disease and reduce the risk of Prosthopedic Neuralgia. Finally, shingles vaccine is used only as a prevention strategy. However, it's not intended to treat people who currently have the disease. The vaccine contains live virus and should not be given to people who have weakened immune system.